I'm going to present as the pledge is on behalf of now more than 200 validated civil society and faith-based organizations in the country. At the outset, I'd like to thank the Ministry, USAID, UNICEF, and the MCHIP Secretariat that gave us this opportunity. And we went through a process of, and we were told to actually come up with a credible, verified list of civil society and faith-based organizations in the 8 poor-performing states and also the 264 high-burden districts. This process was led through an organization called New Concept. It went through 4 processes: identification, selection, verification, and validation. I'd like to convey my thanks to the core group members of civil society who all helped in ensuring that we could end up getting 800 organizations with details of their governance, their areas of activities in the last 5 years, and commitment to the pledge for the next 5 years, which is the 12th five-year plan. This mapping exercise is all on a CD, and all of you have a copy of it in your bags, and we've been told by the ministry that they would be happy to have this data put on the website also for use at state level, at national level, at district level, etc. Coming to the pledge, and those 200 organizations who have responded to actually sign the declaration have signed it with their logos, with their official commitments, and we have all of them, and we'll hand it over to the ministry eventually. And the pledge is as follows: we, the civil society and faith-based organizations, are committed to improving child survival in India. We will work together with communities, the government, the private sector, and other developmental partners to accelerate progress in the RMNCHA arena. We, the undersigned, reaffirm our commitment to the India call to action of child survival and development. Okay. We will hold ourselves accountable for our shared commitments to the people and the Government of India's health strategies and international human rights agreements, and fruitfully engage in the following areas. The first one is drive advocacy for evidence-based interventions, in which the civil society and faith-based organizations will engage in ensuring that they raise concerns of every child, woman, and family for ensuring evidence and equity-driven interventions and policies. The second one is to ensure reaching the unreached, and we as civil society faith-based organizations commit to help in reaching the most marginalized groups in society so that a child's sex, physical, mental abilities, social, economic, or cultural status does not determine the chance of survival or development in India. We will advocate to improve health systems and to make them more sustainable so that quality health care is within the reach and accessible to one and all. The third area is that we would support promotion of convergence and innovation, in which a holistic and coordinated effort across health, nutrition, education, gender equality, water and sanitation sectors are available through all the various government programs to all in India. The next one is to support integrated social behavior change communication, in which evidence-based communication strategies that would get developed would be ones that we would follow and implement in our geographic areas where we are engaged in. The next one is to promote gender equity, in which civil society would help mobilize men, women, children, families, and their communities to promote gender-sensitive healthy behaviors. And the last one is to help and support building accountability, in which we would implement the recommendations of the India's framework for accountability, which are being developed at this point of time for women and children's health in India. Thank you.
Thank you, sir.
May I request the partners who have made pledges to please officially hand over a copy of their pledge to the Secretary?
Thank you, Madam. As President of Indian Academy of Pediatrics and as President Pediatric Association of SAARC countries, I feel immense pride in handing over this pledge to Secretary, sir.
Thank you. Friends, we've come to the end of our workshop, and I would like to request my colleague Anuradha Gupta to say a little about, just to put together the tone and thrust of the discussions of the last 2.5 days, and to place it in context and to tell us what she thinks is the way forward. And I would also like to request her, on behalf of the Ministry of Health and Family Welfare, to formally convey our thanks to the very large number of partners who have been associated with us in this event. But before I do that, it is also my very pleasant duty to thank her and her colleagues. I am well aware of the fact that several speakers have referred to this morning that this event would not really have happened without Anuradha, and I would like to record my appreciation of that and the hard work put in by herself.